Thanks, Sasha, for the introduction. I'm Sherry Mason. I'm a senior consulting director at Vizient. I have my clinical background involves emergency critical care interventional labs and cardiac research. I've been a Vizient about 11 years. I've been a nurse and a nurse practitioner about 30 years. My role for today's discussion revolves around the development and management of the preference card projects. And with me today, I have Mary Ellen from Corwell Health, and I will turn it over for her introduction.
Great, thanks, Sherry. My name is Mary Ellen Kriegier. I'm a value analysis manager at Corewell Health, and within my role, I'm overseeing the establishment of our procedure card management program. I've been with Corewell Health for about 12 years as a nurse leader, and now within supply chain for the past four. Looking forward to the conversation today.
So, Mary Ellen, we just started working on our initiative together, Corwell Health and Vizient. What was the challenge for Corwell Health that really brought the organization to realize that they needed to tackle preference cards, or what Corwell is going to refer to them as procedure cards going forward?
Sure. So, Sherry, I'm going to start with what our goal is so that I can then tell you why we made the decision to pursue that goal. So, the goal of this program is really to reduce supply waste in the surgical space, reduce the cost associated to that, the restocking time that are burdening our clinical and supply chain team members, and the administrative burden of maintaining preference cards or procedure cards, as we're referring to them. So, alongside that, it's important to us to improve our team member and physician satisfaction with the process that they go through to set up for these surgical cases. So, this initiative contributes to Corewell Health's vision of providing a simple and affordable care through reducing the total cost of surgical care, reducing waste, and by standardizing to cost effective supplies where appropriate. So, when we take a step back from that big goal and look at why does Corewell Health want to do this? Why is it important right now? Well, for the past year or so, we have been undergoing integration of two very large health systems. So we're now the biggest healthcare system in Michigan. And with that comes the importance of financial stewardship. And so it's important to us to look at where are gaps in our current processes that we can tackle to really drive down the cost of care.
Yeah, that's really great, Mary Ellen. And we understand just how intentional and how important it's been that you kind of plugged in this process at the right time. How did you identify those that were going to be most critical to your success?
Sure. So, to start with, we knew that this initiative really had to be driven by the senior leaders of the organization. They had to be all in and they had to communicate that to the teams. But at the same time, it can't just come from them, it has to be desired by those who are going to be participating in the work. And oh my goodness, was it desired? As we started interviewing teams across the system, rather than seeing them put a wall up and say, "Don't come into my space," we witnessed actually a sigh of relief from those teams, hearing that the system was putting forward a commitment, permanent, resources to support them in improving those processes. And the reason for that is because procedure cards and managing supplies on them has been a pain point for many teams, not just the clinical teams within the ORs, but also supply chain, how that impacts inventory management, the sterile processing team, and how they contribute to the build of case carts. And so this work really requires the buy-in and the energy of all of those teams.
And that really is what we have been seeing at a lot of other organizations. One of the things that we haven't seen all the time was going through the formal RFP process. So we wanted to see if you recommend that for all or most organizations.
We received a lot of input from the beginning that they didn't think this work would be sustainable without a permanent solution or permanent resources in place. And the main barriers to that long term success were lack of data transparency, data management, a lack of bandwidth for the current teams to sustain the changes. The reason that we took that on is because we knew it was going to be important, one, for us to, of course, find the right partner to help us
Mhm.
through this. But two, because we really wanted to be able to show the teams that this is impacting, that we were very intentional in selecting a partner, both in professional services and in technology, that was a right fit for our organization. I will say though, what we were surprised in how much we learned about ourselves and when going through the RFI and RFP. We set out thinking we knew what we wanted the outcome to be and learned a lot more by going through the process. We learned a lot more about what to ask, what was going to be required for our success, and then the RFP process also allowed us to engage leaders from across the system and participating in selecting a consultant, which really started the relationships that we needed to have established to kick off the work.
So Mary Ellen, we have begun this process a few months ago. So would you mind telling the audience at what stage of your journey are you now?
Sure. So the journey is long. The stage of the journey we're in right now, having wrapped the RFI, RFP process, onboarded our partners in crime here, we just kicked off 3 weeks ago actual on site assessments supported by the Vizient team. And a few weeks ago, started working through the data extraction processes. So we were in the very beginning stages of the assessment and program build. And we expect in the next few months to have at least finished conducting this gap analysis across all of our 24 surgical facilities.
I'm really happy to say that it's going very well, and we're enjoying going on this journey with you.
Yeah. Sherry, I had a thought I might share a few what I might call requirements for success, just
Yes,
to get to the
please,
point where Corewell Health is now in the project. That might be
please.
helpful for organizations considering or wondering, should we be pursuing this? So to share from our experience here, I would say the first things first, you need that objective data that supports the opportunity. So it was not easy to get the support, even though everybody knew there was opportunity. Um, it's not easy to say we're positive there are X amount of dollars there. It's a lot of work to pull together that data, but is absolutely necessary. Second, being that senior leadership level involvement. I think not only not only having them involved at the steering committee level, but also ensuring they're declaring it as a priority and ensuring that their teams can participate in it. I know I'm biased, but the value analysis team is really uniquely positioned to steward that financial sustainability while ensuring that patient outcomes and safety remain a priority. And while our business operations peers absolutely share the same priority, there's a certain level of comfort that comes with the team leading the work being clinically founded, right?
Mhm.
So, lastly, just we've mentioned a couple of times how long this work really takes. So that long-term commitment is important from C-suite down to the unit level. So the improvements will be long, and the work can really never end. So being realistic and resilient is imperative. I think we set out from day one knowing that this would not just be a project, but it would be a program.
Mary Ellen, thank you so much for taking the time to let us know what's important to be able to have a successful project. What I heard from you that's been really evident in our interaction so far is the importance of the communication piece that incorporates everyone from C-suite down through supply chain, value analysis, SPD, the operating room teams, the surgeons, so that everybody is on the same page and they understand the importance and the involvement of all those being asked to participate in a project that is a lot of work, but it does have the potential for a really positive yield. So thank you very much for taking the time to join us.
Yeah, absolutely. Thank you, Sherry. Happy to share our experiences as we're moving through this process from beginning to end, what works, what doesn't work. It's always valuable to share those experiences with peers across the industry so that we can learn from and with each other.